Good morning, everyone, and welcome to our Ask Rich Live online town hall. Rich Leikwig, our BJC president and CEO, is here today to answer your questions, and we look forward to hearing what's on your mind. And today's broadcast is an hour long, and you are able to send in questions along the way. If you're watching this broadcast on the bjc.org website, you can scroll beneath the screen you're watching right now, and you should see a box where you can type in your questions. Throughout the broadcast, we'll take 2 quick breaks where we'll collect more questions that come in. Speaking of questions, thanks to everyone who submitted their questions for Rich in advance. We reviewed all of those questions. There were a lot this time, which was great. And we pulled out some of the key themes for us to cover today. So that's all we needed to get started. So with that, Rich, are you ready to get going?
I'm ready. Good morning, Emily. Good morning, everybody.
All right, great. Well, the first question we'll start with kind of takes us back to when we came together in the spring for our online town hall. And at that point, you had talked about some of our BJC goals and strategic initiatives. And we did have some questions coming in of people who would like to hear how that's going, the progress, and any plans for 2020.
Let me put this in perspective. So in 2019, we launched the strategic planning goals. We spent 18 developing the strategic plan, 19 beginning to implement around those goals. And the 4 goals that we're focused on are customer centricity, quality, scale, scope, think about growth, and then community benefit. Within the customer centricity and within the quality area, we really are focused on outcomes, focused on access, focused on the engagement of our team members, and how we deliver care, the integration of care delivery across the organization. So with those 4 goals in mind, we launched about 12 action teams. And the action teams, some are focused around the culture of BJC, really how do we do more together. Great progress in that area in 2019, more to come in 2020. In terms of scale and scope, we've been focused on some direct-to-employer offerings. We'll talk about that, I think, a little bit later in today's program. That's where urgent care comes in. We'll probably talk about that a little bit, later today as well. Back in terms of quality, we want to continue to make sure that the care that we deliver is of the highest quality possible. That means we've got to make sure we stabilize our workforce so that we're able to retain these great team members that we have and also recruit into those areas where we have shortages. So a lot of work in that area over the last year. Community benefit. For community benefit, probably the biggest initiative that we've talked about and acted on in 2019 has to do with a ballot initiative in 2020 to get Medicaid expanded in the state of Missouri. And so that's some of the examples of some of the work that we've been doing. There's hundreds of individuals across BJC that have been leading these action teams. Mm-hmm. We actually have a retreat tomorrow, the presidents, the executive leadership team, to focus on what do we need to continue to do coming out of 19 as it relates to advancing to achieve those goals over the next 4 years, and what additional work do we need to make sure that we're focused on in 2020. So more to come, and we'll talk more about that as we move into 2020 in the next 45 days.
And so you're definitely right. We did get a lot of questions. I mentioned we had a lot come in this time, and several of them tie back to the areas that you just talked about. So we'll get to those. One of the areas where we heard a lot of questions and comments and things that people wanted to share was around a big announcement that we made earlier this year. This is on the compensation front about our new minimum pay moving to $15 an hour in 2021. We've heard a lot of feedback and a lot of different areas, both inside BJC and outside BJC. And just a couple of the questions that we heard from our team members, several questions came through about the idea of how we're going to address salary compression. So meaning people, where there's just a small difference in pay based on how long people have worked there with that new minimum.
Before we focus on salary compression, one of the things we probably don't do enough is to celebrate the successes that occur across BJC every single day. And I actually look at the decision that we made the end of the summer, coming into the fall, to move our minimum wage from $10.10 to $15 an hour as a tremendous success. It had the support of our board and the support that and the comments that we've received. I mean, the overwhelming majority have been extremely positive. We're the first healthcare organization in this region to make that move. We know our colleagues at Washington University also announced a similar move earlier this past summer. We know the state of Illinois in the next few years is going to $15 an hour for their state employees. So we felt it was important that BJC, join with others and send a message to the community that it's important that everybody who works is earning a livable wage. And for us, that's what $15 an hour signals. We've already moved from $10 an hour to $12.26 an hour as of October. And we will move that again in 2020, and we'll get to $15 an hour by the fall, this time in 2021. With that, though, comes, those that are already making close to $12.26 an hour, they want to know, what happens to my salary? Does it move just as we've moved the minimum wage up about $1.50 to $2 an hour? And the fact is, yes, we're looking at those individuals who already now and have earned close to the new minimum wage, and that's where the compression comes in. So we'll begin to make adjustments for those that are in and around the new minimum wage and move their hourly rates up as well. But it doesn't mean that everybody in BJC is going to see, if we go from $10.10 to $12.26, let's just say it's a $2 an hour more, everybody isn't going to move $2 more an hour. And those are some of the questions we get. Well, why not? Individuals are already well within their range when we compare ourselves to the marketplace. It really were those who were entry-level employees that were disadvantaged. And so I'd ask, all 31,000 of the team members, let's first acknowledge the step that we're making for our community. And yes, those that are in and around our new minimum, we will also be moving them as well. And we also, as we do every year, we will look at every position across BJC and make sure that we're offering a market competitive salary or income. And those ranges will move each and every year depending on supply and demand of the type of job that we are looking to recruit or retain. We've seen nursing salaries, move pretty dramatically in this marketplace over the last couple of years. That's an area of focus for us to address. And typically where we see it move is at the starting end of the wage. But we look at these every single year. We'll continue to do that, and we'll make appropriate market adjustments when the market dictates, signals to us that we need to make a change.
We also received a couple questions from people about this who've worked in other places, and when they had their wage increased, it meant their hours were cut back. And so we received a couple questions about that. If I'm excited, I'll soon be making $15 an hour, but does that mean my hours are going to be cut?
Yeah, I think Target is one of those organizations that, on the one hand, announced this and then said, but we're now going to make everybody part-time, and absolutely not. We're a people taking care of people organization, and you've heard me say that, even with all the technology that's coming into healthcare, and this is the minimum rate change was really to address an income issue. And no, we do not have plans to then take everybody who's moving from 10.10 to 12.26, and cut their hours. Period. We will always, though, as an organization, have to make sure we're good stewards of our resources. And so we'll always be looking at, how we staff. And we really staff based on patient demand. And we'll continue to make adjustments. As demand increases, our staffing needs to flex with that. If demand were to drop, our staffing will need to drop commensurately with a drop in volume. But those are adjustments we've always made historically. And those adjustments in no way are tied to our salaries of our 31,000 caregivers.
So let's shift a little bit, but still stay in the focus under the total rewards umbrella while we're here. And we received a couple questions kind of around the benefits space. And one was about an employee clinic. So people are starting to hear about an employee clinic that's coming to BJC. What can you share about that?
Yeah, and this came out of our strategic planning work, and I'd almost put it under the area of access to care. we've been hearing from our team members, our caregivers, about access during the working hours when they're not feeling well, and trying to get convenient access. So we're going to be piloting in 2020, although the planning has occurred in 2019, to create an employee sort of urgent, immediate care clinic on the academic campus, the Washington University Medical Campus. We're going to pilot it there. One of the reasons we're picking that location, we probably have about 10,000 of our employees, our caregivers, who work on that campus at any given time. That's a combination of Barnes Jewish, St. Louis Children's Hospital, as well as some of our shared services that are located in and around that campus. We're going to pilot it. If we're successful, the next question is, where do we go next? Well, we're not going to be able to bring one of these to every single one of our hospital sites, but you can imagine maybe the second one goes out at the BLI, assuming it's meeting the need, the demand for our caregivers. So this is an action that's in response to what our caregivers are asking us to provide, and we'll see how that works in 2020. And if it's successful, we'll look then to open up another one or two in the future.
Wow, that's exciting. Very exciting
Yeah.
to hear about. So also staying in the human resources space, if you will, kind of the benefits and compensation, but broader. Earlier this year, we announced that our Chief Human Resources Officer, John Beatty, is going to be retiring next spring. And whereas we know we're working on filling this role, we did notice that the title has changed. So whereas John's title has been Chief Human Resources Officer, it looks like the new title is shifting to Chief People Officer. So we received a couple questions, I think, from people who knew the specifics about that. Around, what does that mean? What is that change in title, and what's different about that?
Well, first, I heard the rumor as well that John Beatty's planning to retire.
He might have been the one who submitted that question.
But yes, in fact, we are in the market attempting to find our next Chief People Officer. And the change was actually one that was suggested by a number of our internal HR colleagues. We did a number of interviews across BJC as we were refreshing the job description for John's role, or the next Chief People Officer. And in that feedback, it was suggested by a number of colleagues that a more contemporary title in the marketplace is Chief People Officer. We engaged a search consulting firm who's working with us. We asked them to test the market. What are they seeing nationally? And the trend is that these roles are being, named Chief People Officer versus Chief Human Resource Officer, which actually makes a lot of sense. When you think about the role and responsibility, sometimes HR denotes, well, it's about benefits, it's about pay, it's about policies and procedures. And we really want the next individual who will be responsible for leading this area to help us think about culture, to really think about everything that our team members, caregivers need in order to be very successful. Some of that is certainly compensation and policies and procedures, but it's so much more, and it really does convey the care and the compassion that we want to have for all the people that we take care of. And it also, in some ways, signals to the marketplace that this individual is a member of our executive team. And so when we think about Chief People Officer, it's those that provide the care, but it's also those that turn to us for care. So it's a much more comprehensive signaling to the marketplace of the type of individual we're looking to help lead BJC in this area for the next generation.
So, Rich, we also received some questions, staying on the employee front here, about employee safety, and questions about, what type of work is being done to address employee safety across the system.
It's an important, serious issue for healthcare providers nationally. Probably isn't a meeting I attend outside BJC with other providers where this issue isn't at least raised, and individuals are trying to share best practices, lessons learned. So a couple of thoughts on this. We have, in the last year, standardize our approach when it comes to public safety on all of our campuses. We had a fair amount of variability in terms of the type of resources that we provided. Mike Lauer is somebody we asked to help lead this for all of BJC, and he's doing a great job in taking inventory of what we provide on site and then how we standardize and support those who are there to help protect and provide an extra layer of safety within our care delivery offerings, particularly in our hospital environments. Point number one. Point number two, a lot of the work that we're doing around culture is really to make sure that we're providing a safe environment for our caregivers. Some of that is just mental health and fatigue, and how are we addressing fatigue? Nursing's probably doing the most in that area in developing best practices to support our nursing and therefore other caregivers as well. It's going to be an area that will be at the forefront of BJC and all providers on how we provide the best care, the most safe environment for our caregivers. The issue of mental health. One in four individuals in this country suffer and are dealing with some degree of mental health, mental illness. That means if we're 31,000 caregivers, 1 in 4 of us, are dealing with an issue. So we've also got to make sure that we're providing access to our, EAP program for those who may need somebody to talk to outside of the work environment to help them deal with whatever struggles they may be dealing with outside the workplace, so that when they do come to work, they feel very, very safe. And then lastly, I would say, one of the things we're emphasizing as we do our culture work is the importance of the relationship that exists between our people managers and our frontline team members. Those relationships need to be unbelievably strong, and we need to make sure that we're checking in with one another. How are they doing in the work environment? And that way we're going to learn a few things, maybe some things that we need to improve. I said last thing, I'm going to give you one last thing. And this will be, you'll see more of this, I think, in 2020 as we advance more work around the culture of BJC. A lot of work going on across BJC in terms of high reliability teams and what we call operating systems. I, this year, went to Children's Hospital and participated in one of their huddles. It was phenomenal to see. And then these huddles exist and are taking place in many locations across BJC, but not all locations. And we need to move that out in 2020. The benefit of those daily huddles, it allows issues to get raised. Some are just straight care issues. Some are, I don't have some sort of resource I need. But it also can raise an issue related to safety. And we may then be able to pick up trends that are occurring in other locations, which may mean as at a system level, we need an intervention. And we don't need a separate intervention at Children's, separate from Missouri Baptist, separate from the medical group. We need one intervention to create a safer environment for all of our team members. And that's the benefit of a standard operating system and sharing a more common set of values and culture across all of BJC.
So, Rich, I have one more question for you before we head to the first break. And just as a reminder to everyone watching, you're welcome to submit us questions. We'll see all the questions that are coming through during the quick breaks. So this last question before we break is around pronoun usage. And still under the employee umbrella, this whole first section's kind of been about our employees, which is cool. But we received a couple questions about, some non-binary gender employees prefer to be called they or them instead of he or she. And how are we supporting our team members and our patients through pronoun usage?
When it comes specifically to pronoun usage, I probably can't speak to anything of significance that we've, a policy or something that we've put into place. Probably something we need to look at as we go into 2020. I do believe, though, all the work that we do around diversity and inclusion speaks to the fact that we need to be very sensitive to how we refer to anybody and how we address anybody. You've heard me say this, and I hope everyone that we're talking to has heard me say this. The rule that I think we all need to embrace is the platinum rule. And in order to know how to address you, Emily, my first question could be, how would you like me to address you? And then you're going to tell me, and I'm going to listen. And the platinum rule is do unto others the way they want to be treated, not the way I want to treat you. And I may call you Emily or she, and that may not be the most appropriate way to address you. And therefore, I should ask. So when we're checking in a patient at any one of our access points, we should ask, how would you like to be addressed? And we should note that. With all of our team members, we should ask. And I'd say also, it's a two-way street, and I want everyone to be very comfortable if we don't address each other in the most appropriate, most sensitive way, it's okay to point that out in a very respectful way. That's my MRI analogy, most respectful interpretation. I may address you in a way that is inappropriate to you. I hope you would give me the most respectful interpretation and not assume I'm doing that intentionally. It may be because I'm just ignorant, which that could possibly be, but I hope you would be comfortable enough, though, then to point that out to me and help me understand that. We can put all the policies in place, but if we don't pause for a moment, for 10 seconds, and think about really what do our patients need, and ask them that, the policies won't be worth the piece of paper that they're written on, or the tablet that they're written on. And so therefore I just would ask everyone, continue to remember the platinum rule, certainly when it comes to the use of pronouns, and really when it comes to all the care that we provide to one another.
So great words to end this first segment with us.
Thank you.
Okay, so with that, we are going to pause for a real quick break. Rich and I will look through the questions you submitted, and we have a little video for you to watch during the break. We'll see you in just a few minutes.
Okay, so we're gonna go in. We have an announcement, and we're all part of the cheer squad. Okay. All right. Here we go. All right. Well, we're here because we have some great news. So, as a thank you from BJC, 4 lucky team members who pledged $1 or more to the United Way Jewish Federation campaign by the end of October, and were randomly selected to receive exclusive prize packages. And Chris, you are a winner of the $2,000 voucher for the Carnival Cruise Line. So here you go. Congratulations.
Thank you very much. I don't know what to say. I've never been on a cruise and I've never won anything, so. I just so appreciate this so much, with all my heart.
Yeah, I didn't know what to think, and then I saw balloons, and I saw that paper, and it's like, what's going on? And I remember seeing that, and I was like, and then you began to speak, and I was like, oh my gosh, this can't be happening. It just was like surreal. I mean, there's so many ways this money is used, and my little contribution is just a drop, and when everybody gives like we do here at BJC, it really makes a big difference. And I like to see our numbers climb and exceed, our goal every year, because it is a wonderful thing. So I'm very appreciative of it, and I am going to have fun.
Okay, I hope everyone enjoyed that video, and bon voyage to our big winner. So with that, as we get back started, we had a couple questions come in, and there's two that we're going to cover real quickly here. Because one is a follow-up from what you talked about with the employee clinic. And the question is the clinic a WashU or a BJC facility?
It's going to be a BJC facility, and it's initially set up, obviously, to accommodate BJC employees. We are, though, in discussions with Washington University. It would be crazy to operate two of these on the academic campus, and we ideally would like to do that with them. But it'll be, if you will, billed as a BJC clinic and offering to our employees. And I can't tell you right now exactly what the cost will be through the benefit plan, but it's going to be part of the BJC offering.
Right, and I know everybody will hear much more about this as we roll it out.
Absolutely. It's a good thing. It's a good thing.
I know, it's awesome. And we also had a question come in asking if Rich can talk a little bit about the work BJC is doing in the St. Louis community. It's really outside the walls of our hospital. And is there anything that you think will really have long-lasting impact and create healthy change?
Wow, this question could fill the rest of the time we're together. There is much we do already in our communities and programs that we've got working with a number of the school systems, programs that offer scholarships, opportunities, programs where we go into the school to provide support, whether it's nursing or mental health social workers in certain schools. So a lot of programs that we will continue to invest in. As part of the strategic plan and the community benefit, we called out really 4 areas that we want to be at the table with other community players to make significant improvement in outcomes. Infant mortality, diabetic care, breast cancer, and access to mental health. The first 3 have significant racial disparities in outcomes, which is completely unacceptable in any community, but certainly in the community where we're located, and our purpose is to improve the health of all. So those are areas in 2019 where we're identifying partners that are already doing great work in the greater St. Louis metropolitan area, and how can we align with them better, closer, to begin to narrow that gap, the gap between an outcome for somebody of color and somebody who's Caucasian, like me. We'll hear more about that in 2020. That's kind of some new work for us. And the focus of it is really to improve those outcomes. I mean, the infant mortality rate for an African-American child is 3 times higher than it is for a Caucasian child in our neighborhoods. That's got to change. That's new work, and we called it out specifically in our strategic plan because those are areas that we have to impact. Can't do it alone. We need to do it with other partners that are also as dedicated to that as we are.
So this is a great segue to the strategic plan and all the great work taking place across it. In the beginning, you mentioned the 4 main goals that we're working on, and under the guise of scale and scope. And we had a handful of questions come in that kind of fit under that category. So we'll take a few questions in that space. One of the questions we received is about expanding our BJC presence in the Metro East, and specifically in the Edwardsville area, where right now, we have a lot in Alton. We have Belleville and Shiloh looking into the Edwardsville corridor.
So this is one of those questions where I don't know how much I can share, because I don't know what's out there publicly yet. But here we go. So whatever I say, hopefully we'll be reading about this in the next couple of weeks. We do have focused work in Edwardsville specifically. I don't know exactly where we're going to put a BJC medical group, primary subspecialty care outpatient building. We've been working with the medical group. We've been working with Memorial, Alton, and Christian Hospital, all that provide care in that area. And we've come together as BJC to put an outpatient ambulatory facility there. I don't know any more of the details, which is probably a good thing. But I can tell you as we go into 2020, again, we should expect to hear more about that and when it'll open and be operational for those who live in Illinois that are part of the BJC family and those patients who would like access to our care a little bit closer to home.
Wonderful. Well, kind of going around the St. Louis metro area on the west side, we'll talk about the new Barnes-Jewish West County Hospital. We had a question come in asking, hey, how did the opening of the new hospital go?
I would say it went very, very well, and that's a tribute to thousands of individuals, certainly the team at Barnes-Jewish West County Hospital, who were living the moment, closing one hospital and opening the next hospital, but they were surrounded by a host of other colleagues across BJC to make sure from the facility design, construction, planning, when we opened the doors, it functioned as it was designed. To those in the marketing side who helped us promote the grand opening, to HR who helped recruit some new members because it's a much bigger facility, certainly in terms of square footage, but a team effort that we all should feel very, very proud of. As we sit here today, the new hospital is open, the old hospital is closed, and we will begin to take down the old hospital in the months ahead. We still have to open up the new medical office building that's contiguous to the new hospital, and that will occur later in 2020 as well. But great success. What I would say though, for many of us, to see a new hospital open, and I recognize it's a replacement, but it really was closing and opening, it can happen once in a career. For BJC though, if you look at us over the last 26 years, we opened a new hospital with Progress West, going back 15 plus years or so ago. West County is the brand new complete hospital, but when we brought Memorial into the family in 2016, shortly thereafter they opened up the new facility in Shiloh. So we've had a lot of new openings, and then on the academic campus, a lot of expansion for BJH and for Children's. But the opening of a new hospital is pretty special. So congrats to the BJ West County team, and thanks to everybody who helped make that dream a reality.
And we also received a couple questions about Boone Hospital, and is there an update on the Boone transition? Yeah,
we're still on schedule. Again, for those that maybe aren't as close to this issue as others, we've had a relationship with Boone Hospital since BJC was created, and they came into the BJC family as part of the Christian healthcare system. We agreed a couple of years ago mutually that we would end that relationship at the end of 2020. It's the only hospital where we have a lease arrangement, even though all of the care members there, the team members, are BJC employees, the medical group, or BJC medical group physician and providers. But at the end of 2020, that relationship will terminate, and the Boone County trustees, who are the governing body for that facility, have indicated they will go alone. They won't partner with somebody like a BJC when January 1, 2021 comes around. A lot of work still going on in support of the team, so we can make sure it's a very smooth transition as we roll into 2021.
Right. Thanks for those updates. We also received some questions about something else we've talked about in the past with urgent care. And is BJC still looking to get into that space?
We are. It's proven to be more complicated than any of us really expected when we made a commitment really coming into 2018 that BJC needed a presence. We spent 18 and early part of 19 talking to other partners. Our thought was the best way to get in was to do it with somebody that offers these services already, either locally or nationally. As the dust has settled, and in partnership with Washington University's faculty practice plan, our game plan now is to do something together. We may manage it on our own. We may decide to use an outside partner to manage a few of these sites. We still, though, have plans. Now it's going to be 2020 to open up a number of urgent care facilities in key locations around the greater St. Louis metropolitan area. Don't know how many exactly yet. My guess is somewhere in the neighborhood of about 5 in 2020. And then we'll step back and decide, is this something we need more of? Or is virtual care, going to sort of skip over urgent care facilities in the future? So it's still on our list of things to get done. It's still a priority for BJC, and I probably said this time last year I was confident, in this year we'd have some open. I'm confident we'll have a few open in 2020.
We had another question come in that really ties to that, and it was around your thoughts. Do you have any thoughts on expanding telehealth as part of an urgent care platform?
Yeah, telehealth is another delivery mechanism. Matter of fact, in some areas across BJC, we already offer telehealth. We do tele-ICU. We use telehealth to help our patients that are suffering from a stroke. The real question is, as we think about primary care and urgent care, will telemedicine replace some of those visits? The short answer is absolutely, it will. Our consumers are already taking advantage of that capability nationally. So as we refine our digital strategy, telehealth, virtual care, virtual appointments on demand will be in our future.
Neat. And Rich, I have one more question for you before we go to the second break. I feel like time is flying by at this point. This is a question about direct to employer. Somebody said they've heard the term direct to employer. Can you talk about what is that and why is that something we think we need?
Yeah, so as we looked at our scope of offerings, today, as a healthcare provider, we contract with insurance companies. The insurance companies oftentimes have been contracted by an employer, a self-funded employer, much like BJC, where we're self-funded. And we decided we wanted to pilot an opportunity where BJC goes direct to the employer, if you will, cuts out the middleman and provides an offering to their employees directly. So we've been working, our managed care group has been leading this effort, but also working with the medical group and our care providers. And we do have a product now that we plan to offer to some small employers, again, in the regions that we serve. Small, think less than 500 employees. So not somebody as big as BJC, that would be biting off, too big of a bite as we get some experience. And our goal is for the employer, the payer is the employer and their employee, is we want to provide access to a high quality product, BJC, at a cost that is more competitive than what they would get without this particular offering. We'll launch it in 2020, and we'll share what we learned at the end of 2020, and we'll determine whether this is a strategy that we want to continue to advance with more small employers or quite possibly even mid-sized employers. So stay tuned.
Great. Okay, so with that, we are going to pause for our second break. When we come back, we're going to cover some of the rumors that came in. That's always a fun section to do. So as we take this break, we actually have a little video that we're going to show about Medicaid expansion. And you mentioned that earlier as being one of our priorities. And we have a video that the Healthcare for Missouri team put out, and we hope that you enjoy it. We'll see you in just a few moments.
My name is Sarah Auksher. I live in rural Missouri, and I am in the healthcare gap. I take care of Kyle, who has Duchenne muscular dystrophy, and it's a neuromuscular disease.
My name is Lakeisha Reddit. I just gave birth, and like many moms across the state, I fall into the healthcare gap. If I'm not around, who's gonna take care of my children? I really do think about it all the time. They depend on me to work to be able to take care of them, and so I need access to healthcare.
My name's Louis Grothman. I'm in the coverage gap. I was born with diabetes. I owe well over $100,000 in medical bills. I'm a hardworking Missourian. I work 15 hours a day, and I still can't afford health insurance.
Medicaid expansion is the right thing to do. It's a fiscally responsible thing to do as well. All Missourians need life-saving care. That's why we're launching our campaign to put Medicaid expansion on the ballot.
Medicaid expansion will help deliver health care to over 200,000 people in our state. we can bring over $1 billion of our tax dollars home from Washington every year.
Missouri is one of the 14 states that has still not expanded Medicaid. This is a chance for us to return those tax dollars back to the state. It creates thousands of jobs. It will help boost our economy.
I have to stay healthy. If I get sick, Kyle could get sick. My cold could be his pneumonia. His pneumonia could potentially kill him. I couldn't live with myself. I have to be able to go to a doctor, and right now I can't afford it.
I feel so strongly that hardworking Missourians across the state deserve affordable health care so that they don't have to decide between their medications or putting food on the table.
I run a rural community health center here in Missouri, and we're seeing a significant number of patients that should be seen in a hospital. But unfortunately, the hospital is over an hour away. We try to help everyone, but if they're having a heart attack, there's only so much we can do.
Missouri families have waited long enough.
It's time to let the voters decide what's best.
Join us.
Join us. Please join us. Help us deliver health care for Missouri.
Welcome back, everyone. Thanks for submitting your questions. Rich, we received a handful here, and there's a few that are kind of going back to the benefit space, so I'm going to kind of group these together. One was a question around maternity leave, one was a question about BJC's healthcare insurance being expensive, and one was around the waived cost to the lab blood work and x-rays for the health packages. I know there's a lot of questions, but is there any, kind of general comments that you can share on those themes?
Yeah, couple thoughts. I mean, for those that have specific questions about a specific issue within the health plan offering, I would direct you to your HR business partner who can make sure you get the right detailed answer, because I'm not going to be as familiar with all the details. But in understanding the questions, let me just put benefits in a broader context. We talked about earlier in the program about minimum wage and compensation. We benchmark our benefits program as well. You will always find a component of our benefit offering that may appear not to be as competitive as some other employer in the region. When we look at the entire package, it's a very competitive program, and that we're very proud of. We offer PTO, and so as a result, we don't carve out sick leave and holidays, and it's a package of offering, and individuals can choose those, and that's a little bit related to the maternity. And we've had questions about maternity and paternity leave in the past. It is something we continue to look at, though, and not to say we will never do it, and I'm not going to say we will do it. It's something we'll continue to test the market and see for our workforce whether that's something we need to be thinking about and offering differently. In terms of affordability, our benefit package relative to how we cost share, extremely competitive. And that's something we check, and we try to do everything we can each year not to increase the cost to our individual caregivers, our employees, and at the same time making sure we're competitive. In terms of the specific questions around some new offerings this year, which plan is it offered in? I'd refer that back to our HR business partners to make sure you get the right answer.
Excellent. We also received a question in around data and about data being so important. Is this something that we're looking at, bringing a directory to managing data?
Healthcare data and the use of data is front page. If you've watched the news this past week, you saw Ascension, sharing data with Google and the attention that's brought. Without a doubt, as we become more digital focused, and we've got a wealth of data, health data. Number one, we take that data and we care for it very responsibly. It's the patient's data that we're entrusted with. So we've got HIPAA rules and everything else, and we make sure that we protect that data. And at the same time, as we mine that data, it's going to help us improve the care that we deliver. We're constantly in discussions with the university about how best to use our data to advance the health care that we deliver. But at all times, we're going to make sure that we protect the identity and the sanctity, if you will, of the individual's data. It'll be a part of our industry, though, that's going to continue to advance. And we talk about, as a healthcare provider, the importance of the clinical data. And at the same time, we talk about the importance of social determinants of health and how that actually influences the health of a community so much more than the clinical care that we provide. Oftentimes, you'll hear the comment that your zip code is more important and a better predictor of your health outcome than your DNA code. As a result, as providers, we're all going to be looking at how do we take the clinical data and marry it up with some of the social determinant data so that we can be a better holistic care provider. If we do that, we'll make sure that we protect that. But that's the type of things we've got to be thinking about as a very progressive healthcare provider, while at the same time making sure we have good processes and systems in place to ensure to our consumers, our patients, that we're protecting their data at all times. So you'll see more investment, infrastructure, mechanisms to improve how we use that data to advance the outcomes for our patients.
So thanks everybody for submitting those questions. We'll jump back into our pre-submitted questions here and get to our rumors section that we mentioned.
Okay.
And so Rich, you've actually talked about this a little bit around cultural transformation. There was one of the questions or rumors that came in was, we've heard, some people have heard the talk about BJC working on a quote unquote cultural transformation and asking us, what is that? What does that mean? And there's also some questions coming in about, I heard rumors that iCare, iCreate, or SPE are going away and will be replaced with something new. And the question is, is that true, and why would we change our values?
There's a lot in there that's actually very true. We've talked the last 2 years, certainly since I became CEO and president, that we need to do more together. And we have a lot of local cultures, which we want to continue to nourish. At the same time, we want to make sure, though, that we have a degree of consistency, that when a patient, a customer, or consumer accesses us anywhere, they can expect a similar set, a consistent set of outcomes. And as caregivers, we show up and we can demonstrate we have a consistent set of values. So there is a cultural transformation that's going on across the organization. And it's being fueled by a desire to produce a higher level of outcome at a more affordable cost and more access to our care for our community. And therefore, we're going to do more together. The iCare values, as an example, that exist locally, we have an action teams that have been working on this, and they are going to advance as we go into 2020, one consistent set of values. And so as an individual, if you start your career in shared services or one of our HSOs, and you advance and migrate, why should you have to come up with a different, or remember a different set of values depending on where you work across BJC? Wouldn't it be easier if we all just used the same terminology to express what the core values are for BJC? So that's part of the work that we're going to be doing. And we'll talk more about that as we get into 2020 and what that does mean locally for some of the acronyms that we use. Ideally, we'll have one acronym for the entire organization. But the values are going to feel very similar to the values that iCare and others have represented over the years.
Well, I kind of crunched those two rumors together because I know we're getting to the end of the broadcast. But we have one more rumor section that I wanted to be sure to hit this question because it came up a couple times. And that's around our BJC pension plan. There have been some rumors swirling around that the BJC pension plan is going away. Can you comment on that?
This comes up, I think, every year. I've been here 10 years now, and in some form or another, I get asked that question. No, the pension plan is not going away. We actually, as part of our benefit offering, we talk a lot about the fact that we still have a pension plan for all of our 31,000 individuals. For most, there are a few exceptions out there, I believe, and that's something we're going to continue to invest in. It also is one of those benefits that we periodically take a look at. You're not going to find a pension plan at most of the businesses here in the greater St. Louis metropolitan area. And companies have frozen those and sunset those. That's not on our time horizon or on our horizon. We value it, we support it, and we invest in it.
So, Rich, we're going to start to transition into our closing segment with just a couple last questions for you. One was a comment and a question. I thought it was really nice, so I'm going to read this to you. Rich, it was great meeting you at the MS ride in Godfrey. Can we have more BJC-sponsored bike rides together? So you might need to give a little context to what that was.
So there's a large number of BJC team members that for years ride and support in the MS 150 ride, which is the ride that was being referenced in the question. And we have multiple teams, but we all come together as a big BJC team. And I've now ridden in that for the last 10 years. It's for a great cause and supports many in our communities that are suffering with MS, and also supports those within our network ecosystem that are doing research to advance treatments for MS. So, a very important ride for us. I also ride and pedal the cause, which celebrated its 10th anniversary this year, and that's another bike ride that supports the Siteman Cancer Center and Siteman Kids at Children's, but it really supports those that are battling cancer and raises dollars to support our physician investigators that are looking for new ways to cure and treat cancer. And there's lots of other biking, running, walks that BJC continues to support and will support in the future. And I'm proud that we have so many of our team members that get involved in many of those events that ultimately support the local community.
So you mentioned for the past 10 years, because you've celebrated your 10th anniversary this year.
I did indeed.
Does it feel like it's been 10 years?
No, it's flown by. I really measure it by my daughter, who was in 4th grade when we moved here and now's a sophomore in college. That's why I know, oh my goodness, things have flown by.
So the next question we received was about 10 years ago. And the question was, what's been your biggest surprise since coming to BJC 10 years ago? And what's your proudest moment?
My biggest surprise, fortunately not a lot of surprises, I think, which for me is a good thing. I like surprises if they're all good. But if I really look back on the 10 years, and more importantly, when I first arrived here, the biggest surprise for me was the fact then that we were on 3 or 4 electronic records, medical records, and that we hadn't migrated to one. Obviously, we're on one now, and I get it. Electronic records are not the panacea of everything in healthcare, but the fact that we are on one, and we're on one with the university, with Washington University, positions us to really embrace this digital transformation that's occurring in the industry and that BJC is able to embrace to provide a more customer-centric experience. But the fact that 10 years ago we were on, I think, 3 or 4 was a real surprise. I didn't ask it in my interviews, and no one volunteered it either. But it's been nice to see the progression over the last 10 years.
So what would you say you're most proud of?
I'm most proud, and I'm proud every single day I wake up and pinch myself. Proud that I get to be part of a team. You've heard me use the term 31,000 caregivers, time and again this morning, that I am part of a team that is dedicated to improving the health of the communities that we have the privilege to serve. And I'm probably proudest most of all, if I had to really put an emphasis, is as we set our strategic vision in 2018 and called out our goals, that you would expect for a clinically integrated delivery system like BJC, that we would have customer centricity and highlighted, quality, the quality of the care, highlighted, growth, scale, and scope, highlighted, and underpinning all of that is a reliance on a world-class engaged team, and that we're going to drive great outcomes at a more affordable price for our customers. You would expect that. But what I'm most proud of is the fact that we've got a fourth goal, and that fourth goal is around community health. And it's ensuring that we leave nobody behind. And that's what the minimum wage was a little bit about, making sure we leave nobody behind, particularly somebody on our team. And that's the question is, how are we getting into the community? It's the fact that I'm part of a team, part of an organization that's focused on social determinants, is focused on the inequities that exist, that embraces diversity and inclusion in the way that we talk about it day in and day out. And so I get a big smile on my face every single day. I'm so proud of the work that we all do to advance health in our communities.
So, Rich, we are just about out of time. I have one final question for you before we wrap up, and that is really just an opportunity for you to share any final thoughts that you have with team members as we close out the broadcast and as we start to close out 2019.
Yeah, it's hard to believe we're closing out 2019. One, I should say, in this season of Thanksgiving, we just finished our United Way Jewish Federation campaign, and thanks to everybody, we achieved our goal, which means really we're part of the St. Louis campaign that also had a phenomenal campaign this year, and that goes back to community benefit. All those dollars raised go back into our community. So one, thanks everybody for participating in that campaign. And then my last message would be, we are entering into the season of Thanksgiving. So you just gave me an opportunity to say what I'm most proud of, and I won't have an opportunity to see everybody between now and the end of the year. I want to thank you for everything you do day in and day out to really care for all those that turn to us in need. I want to thank you for being committed to our purpose, and I want to wish for each and every one of you that you have a very healthy and happy Thanksgiving season and whatever holidays you celebrate in the month ahead. Happy New Year, and we get to do this all over again in 2020. Thank you.
Rich, thanks for your time this morning.
Thank you.
And thanks everyone for joining us today. We'll have this recording available on BJC Net later this week, so if any of your colleagues were not able to join you today, you can let them know they can see the recording. Thanks again, and happy Thanksgiving.